Open the liner by first unfastening straps and removing the front shell. Cover the patient's wound with an appropriate dressing. Mark the wound location on the wound dressing with a transferable mark using iodine, lipstick, indelible ink pencil, etc. Reposition the insole within the liner with the heel properly located at the back of the device. While seated, place the foot inside the device. Ensure the proper location of the patient's foot before transferring the mark to the insole. Wrap liner securely around foot and leg. Have user bear weight to ensure transfer of relief zone mark. With the patient seated, remove the device. Remove liner and insole. Lightly press on the transferred mark on the insole and remove elevated hex plugs. Caution: do not make the relieving area too large, which may allow the ulcer to contact the bottom of the device while weight bearing. Reinsert the insole into the liner with the hex plugs facing away from the patient's foot. Reinsert the liner and insole into the device. While seated, place the leg into the device. Wrap liner securely around the foot and leg and place the front shell over the foot and leg. In the following order, fasten the ankle strap, the foot strap, and then the cuff strap. Tighten straps until snug and comfortable. Strap adjustments may be necessary with changes in lower limb volume. The lower leg should be kept at a 90-degree angle with the foot. Use the positioning portals at the back of the device to confirm that the ankle is centered and that the heel is not pressed against the back of the device. Inflate air chambers by pressing plus on the air bulb and deflate by pressing minus. Inflate or deflate until snug. Note: the air system is designed with a feature to prevent overinflation. A disposable compliance strap may be placed around the ankle of the device to inhibit removal. Place the strap through the strap guide on the front shell before securing the compliance strap. Note: use of the compliance strap is recommended. The compliance strap is for single use only and should be replaced by the clinician when the device is removed. Cut the compliance strap with scissors to remove the device.